The Dan Yorke State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
Good evening and welcome to my State of Mind. I am Dan Yorke. The masks come off in the schools, but it's not that easy. In fact, it may even become more complicated. Tonight, we talk to Dr. Jim McDonald, who is the interim director of the State Department of Health. He hardly needs any introduction, so let's get right to it. First, a story from WPRI 12 as to what was announced on Wednesday.
Rhode Island joining a growing list of states dropping mask mandates in schools.
Since Rhode Island experienced its last spike in cases in early January, cases are down by nearly 94%.
The statewide mandate in schools is ending March 4th as long as COVID trends continue to improve. Masks or proof of vaccination requirements at most indoor spaces, including businesses, will no longer be required starting this Friday. However, masks will still be required on public transportation, including school buses, due to federal rules.
School masking policies will be decided by individual school districts, not the state.
It's welcome news for some, but not all parents are on board with the change.
Too many kids in one class, they're overpacked. So I don't think they should drop it.
The state will be doubling down on vaccination efforts, says McKee, as vaccination rates vary in school districts.
The vaccination rate in Barrington is 78% in the schools. It's 32% in Providence, 31% in Central Falls. We have to do better.
Providence schools are controlled by the state, but the education commissioner says the masking policy in the capital city schools has not yet been decided.
And so I'm pleased to have Dr. Jim McDonald, who is now the interim director of health and certified nuts to want to do this kind of a job. It is in the middle of this, Doc. I mean, one of the great things I think you have established is a persona of a little bit of perspective and a lot of bit of sense of humor. So I appreciate that, but it's got to be, nobody bargained for this. And certainly health directors must be wondering sometimes, why this career choice, huh? This has been great.
Well, you know, it's funny you say that, Dan. You know, when I left the Department of Defense 10 years ago to come here, it was actually during the time my wife was just diagnosed with ovarian cancer, and I was trying to dial it back quite a bit and try to get to a much more calmer life. And it's funny, my wife's doing great. She's still in remission 10 years later, but it's not been dialed back at all. And it's one of the things about public health. It is kind of funny. Part of why I wanted to get into public health was I wanted a job that every day was different and every day was a challenge, but I did not anticipate this. That much is certain.
Yeah, well, nobody did. And your post-traumatic stress will figure itself out when this whole thing is over, if it's over. And of course, we talk about those definitions all the time between pandemic and endemic and what is over and what is just something that's going to be built into what we have to deal with. Let's get right down to the news of the day, though. The mandates being lifted, it's quite confusing still to a lot of people. And even on the radio yesterday, as I was, again, we're recording this on Thursday, you're watching this on Friday night and on Sunday. It's going to take a little bit of work here, it seems to me. Before I start penetrating some of the details on this, can you outline for me? Well, I think it's pretty self-explanatory that we have a public health mandate relief. And so, you know, public buildings, no matter the capacity, will at their discretion ask for masks. If not, you don't have to wear one. I think we get that. From the school mandate point of view, one of the things that I think is fascinating is from state to state, Rhode Island included, Governor Baker in the morning on Wednesday, Governor McKee in the afternoon, following Governor Lamont, Governor Murphy. So New Jersey, Connecticut, Massachusetts, Rhode Island fall into this, we're not going to mandate masks in the schools anymore, local discretion. Easier said than done, Doc.
Oh yeah, it's definitely easier said than done. You know, I think the big message about the mask mandate is the state's not telling everyone what they have to do at this point, but it really brings it back to the local educational agencies. And what they can do is what makes sense for them. Now, we're going to be giving recommendations, and our recommendations are going to be statewide. It's going to be based on case counts, and we're going to offer some, advice for school districts if they want it. What it really is about returning this decision in particular to the school districts. Now, one thing we'll say is we still know the disease is spread the same way. If you're next to somebody, it's spread pretty much through droplet or, airborne. But really, when you get right down to it, because the case counts are dropping and we're seeing our hospital capacity getting so much better, it's time for local school districts to make their own decisions about what makes sense for them.
Well, this is the thing. In addition, listen, you're an established professional. You chose your field, and so did I. The one group that I've never been easy on until the pandemic, the school committee members. You want to talk about a bunch of folks who didn't bargain for this, right? They just wanted to change the math curriculum, for heaven's sakes. They just wanted to give back to their community, for heaven's sakes. They just wanted to do right by kids, or some of them wanted to, begin their political careers with the small stepladder of the school committee. Now they got to make decisions on what feels like still life and death. And I just don't know how I just don't know how they're going to execute this thing without a high level of consternation and kind of a hit or miss discretion feeling amongst the constituents.
Well, I think the constituents is part of the issue that's a challenge. If you're a school committee member, I think you're exactly right, Dan. I had a brother who was on a school board, and just because he really wanted to help out, wanted to give back. But that's one thing if you did that a decade ago. If you did it now, what you didn't sign up for as a school board member or a school committee member was the anger and, quite frankly, all the contrariness, right? And it's that anger. And, one of the things I think we need to take a step back from, just not as a people, as a species, is, wow, we are much lower threshold for being angry with each other over something that, quite frankly, anger never helps resolve problems. I've just found that when you think about when we're angry, it doesn't make us think more clearly. And one of the things that I think we see with strong feelings is we've got to keep our conversation respectful. And one of the things I learned when I was in the Navy, by the way, was when the commanding officer made a decision, once I spoke my piece, if the commanding officer went a different direction than I moved into, it's like, well, I just need to fall in line and follow. And that's something we have a hard time doing as a people. Yeah. And I get that,
Yeah, well, hey, listen, nice speech. I'm with you. Try hosting weekdays 3 to 6 on WPRO. It's not there. Here's the thing. Why don't we do this? We're going to pause, and we're going to come back, and we're going to dig into actually how this is going to work between not church and state, but between district and state. The Ed Commissioner said something really profound in the briefing on Wednesday that I'm very concerned with, and I'm sure the doc will have an answer. I certainly hope he will. Stay with us. Dr. Jim McDonald on My State of Mind. Be right back. Back with Dr. Jim McDonald from our health department. It was a newsworthy week, and it will be, because this transition beginning March 4th for the state to let the schools handle their mask decisions. Well, it is a big piece of news. Here's the thing. I'm not going to get bogged down in dates. Why did Charlie Baker decide the 28th? Why did Ned Lamont decide the 28th? Why did Phil Murphy decide the 7th? And Rhode Island decided the 4th. I try to argue with some folks on the radio who just, are standing on their heads over a week delay, and we can't wait another week. School committee meetings are on a cycle. They've got to figure out how to get together and make this vote, seems to me. Getting your collective act together to be able to re-implement a return to normal takes a little bit of time. A lot of people don't have, speaking of patience, a lot of people don't have any patience even for that. So everybody's elevated. We get that. What I'm concerned about is metrics. And the whole way, I haven't necessarily been heck bent on the idea that we had to have a metric for everything all the time. But actually, there was a metric that guided us pre-vaccine. In fact, when this thing first hit, there were a lot of 10 cases per 100,000 formulas that were out there. And it seems to me, Doc, that going back now to a mask relief ought to offer some kind of metric. Maybe it's not 10 per 100,000 daily, maybe it's 50, now because we are vaccinated, and Omicron is not as efficacy, whatever. The efficacy is not as different. You know what I'm saying? I feel wanting in this situation.
I agree. And I think, it really gets about managing risk, right? The lowest risk is when you're less than 10 cases per 100,000 per week. And it's,
well, is that per week? I'm sorry, per week or per day? Because per week is impossible. I mean, I don't know how you'll ever get to that.
Well, it's 10 cases per 100,000 per week. That's lowest. But, we were there one day, by the way, over the summer, one day. But we're going to get there eventually. Where I see us getting into moderate transmission, where we're less than 50 cases per 100,000 per week, is I think in the first week of March, second week of March, we're going to be in moderate transmission, less than 50 cases per 100,000 per week. And that's a lot to do with why our date was what our date was. And also get kids back from vacation for a week, make sure the schools feel like they know what's going on. And I think that metric does make sense a little bit, because if our case counts are down quite a bit, you just have less people to worry about, quite frankly. The other thing that coincides with that, by the way, there was that when I look at our hospital capacity numbers, the hospital numbers are getting better, and our predictive model shows they're going to continue to get better. So there are some metrics that I think are still going to work quite well for us as we manage forward. When we give recommendations to the schools, we're going to give them in a graduated, here's the recommendations based on the case counts, whatever makes sense for them, and they can follow it or they cannot. The one thing schools need to look at, though, is can they use their trusted voice to promote the vaccine numbers? Because we have some great vaccine numbers in some schools, but not some really good vaccine numbers in other schools.
Okay, so yeah, just on this per 100,000, I get confused. I don't know how you get to 10 or 50 per week when I see the numbers at 500 per 100,000. It seems to me that on a daily, in other words, if you've got 500 cases on a day yesterday against the population, that's 50 per 100,000 per day. I don't know how this weekly computation works. So
let me give you some perspective on that, Dan, if I can. 4 weeks ago yesterday, we were at 3,300 cases per 100,000 per week. Yesterday, which was Wednesday, we were about 390 cases per 100,000 per week. You don't have to be a math whiz to know that 3,300 is way different than 390. And this is one of the things you see with the Omicron. When you saw it in other parts of the world, is it peaked fast, but it dropped fast. And I think that's one of those things that we're seeing here as well, is that it did peak fast. Martin Luther King Day weekend here was hard in Rhode Island. It was a hard weekend here, but it's been dropping very nicely, very quickly.
Okay, but here's the thing. Timing being what it is, I get that all the governors are folding under, and I get the CDC wants to manage the entire country. So they get a little queasy about these moves, but they're speaking for 50 states. What I don't understand is the press briefing on Wednesday more or less opening the gates to, and all people hear, by the way, is no masks in schools. That's all they hear. You need to know that. That's all they hear. And you didn't offer any numbers along with this. So now you're going to backside recommend the numbers, but you've already kind of, spiritually committed schools to relief of masks. So what is the actual, weight of your recommendations to the school districts, and when will they be available, and when will they be able to lean on them to say, you know what, we're not ready yet, if they choose to?
Yeah, and I think this really speaks to some of the issues we saw over the summer, where schools were like, we're trying to figure this out, and we're looking for recommendations. So our recommendations are going to come out to the schools next week, and they'll have a chance to look at them. And we're doing that basically through meetings with them first, and then releasing them to them. But we have a good idea of what schools are looking for. We have constant relationship and dialogue with the schools, and really it gets to like giving the schools the tools they need to make their own decisions. And schools can do that, and school committees are ready to do that. And I think part of what schools want to do is like, hey, how do we make this make sense? But I think you're right.
But the school committees don't want this. I talked to the School Committee Association Executive Director, Tim Duffy, yesterday. They didn't want this at the beginning. They wanted a state mandate, state release. They didn't want to make this. They don't want to make these discretionary decisions, and they don't feel equipped to even interpolate your data. So, boy, I'll tell you, the spirit of your work here, I understand, and believe me, everybody wants to go where we think we're going here. But how to get there is still something that I think is very confusing for elected officials and for the public to understand why elected officials are doing what they're going to be doing. So it's fluid, no doubt. But here's the thing that really bothers me the most. Angelica Infante-Green, our commissioner, said something profound. She said, hey, listen, Barrington's got near 80% vaccination, and Providence has got 32, and Central Falls has got 31. The irony of that, Doc, is we talk about the learning gaps all the time here, and the urban kids who are ridiculously challenged by those gaps. If we agree that on balance now that the psychological and educational welfare of kids is worthy of taking masks off, but those kids, because of low vaccination rates, can't, it only widens the gap of disparity between the suburban and the cities. And it seems to me a 5-alarm fire marketing vaccination on the ground plan better happen in the cities in order for them to have a chance to do this, right?
Well, I think vaccination is really very important. Now, you know, we've done a lot with vaccines, by the way. Like, in other words, we've done our best to just make sure it's widely accessible. We've had it everywhere. You know, I think what you get with vaccines, though, is it's a trust issue. It really is a trust issue. When people aren't getting the vaccine, they just don't trust that this vaccine is for them or for their child. And that speaks to larger cultural issues in this country, quite frankly. There's a lot of trust issues here. And I really think it gets back to, like, you know, when schools make their decisions about whether or not they're going to have students wear masks or not wear masks, we're going to be as helpful as we can to them. But if you want to make your school in the best position possible, if I'm a school teacher, I'm using my trusted voice. If I'm a school administrator, I'm using my trusted voice to say to people, look, the vaccine got us to a great place. This is what's going to keep us in a better place. Can you take some, you know, take some moment to talk to your doctor about it?
But you do see that the forecast will there be a stipulated state recommended vaccination rate in order for a school or a school district to feel comfortable to open?
I wouldn't say that's coming. I think the school districts really need to look at this, like, the more kids we have vaccinated, the lower our risk. But really, it's more going to be case counts and what the prevalence is in the state. And I think that's a metric that people can really anchor on. And then, you know, do what they can to make it work. And by the way, some school districts are going to say, we're not ready yet, and that's going to be fine. Other school districts are going to be like, we're going to do what we want to do. But I think you're going to see that what we didn't say yesterday was no masks for schools. What we said was, we're releasing a statewide mandate and we're returning this decision back to local educational authorities.
Yeah, but it's not going to be fine. It's not going to be fine.
No, a lot of the pandemic hasn't been fun.
No, understood. That's a given. But you know, when some schools are off mask, some schools aren't. And if the urban centers are, I just think that the state has got to couple this release with a maintained responsibility to market and infiltrate the communities with a real surge of vaccination, because regardless of who hasn't gotten what yet and for what reasons, you can't leave the urban communities you know, drooling for the suburban communities move to no mask in the schools in perpetuity. It can't happen. You want to talk about civil cultural war? I mean, we've got enough of it in a whole bunch of directions, seems to me. So I hope that there's going to be a real effort to triple down on vaccination in the cities.
Well, it's something that's important to us. You know, we're working on messages. Quite frankly, I've been reviewing data today about what are the reasons people aren't vaccinating, and I really think it's important to look at, like, the reasons people aren't vaccinating are different now than they were 5 months ago. You know, people are still worried about long-term side effects, and quite frankly, there really aren't long-term side effects. The vaccine's been available quite a long time now. You know, all the vaccines we've had, if you've had a problem, we would have had it by now. But when I look at the data I'm seeing, it's really people are really focusing on mistrust. They don't trust, and it's really not just they don't trust government officials. They don't trust pharmaceutical. They don't trust the messages they're getting. And I really think you speak to this large issue. People have just lost trust. And it really, it's about restoring trust. And I think this gets to a much larger cultural issue for us. It's like, why is it in our country there's so much mistrust? Because, you know, I look at the people I work with at the Department of Health, Dan. They're good people. They try to get everything exactly right. I mean, I find I work with a bunch of very trustworthy professionals, but I think we have to see why in our culture do we have such a trust problem. It's a problem.
But without it, listen, this is the conversation I have, you know, each and every day. Respect, or actually recognition of authority and expertise, has gone out the window. Institutional respect has gone out the window. It's very difficult. By the way, before I ask you about your transition for a couple minutes in our last segment, can I get one thing off my chest? Not that I haven't. This athletic situation is embarrassing. You take a look. I was at a basketball game, high school basketball game last week. 10 kids on the floor. All 10 had the masks on incorrectly. It shouldn't wait until March 4th. There should have been a separate discussion of the athletics. It's ridiculous. I mean, it actually makes a mockery of the masks. They're not worn properly. They're actually dangerous, I think, in some ways for kids to actually be competing with them. Quick answer on that, please.
Well, I think that's the issue, though, Dan, is like when you look at why the country struggled so much is like when I learned how to wear a mask, I was taught professionally how to wear a mask. And I think that's one of the things where it's like, people just don't get it. You've got to wear it correctly,
but you weren't running the 1,600 meters wearing the mask, and you weren't, you know, driving into the basket for a layup, getting fouled and having it across your face, or pulling it down so you can go to the hole. I think there's a big disconnect there, and I think, you know, the sooner or later you revisit that, the better. And I know the superintendents get involved, and it's whatever. When we come back, how the doc's doing on transition. Stay with us. Back with Dr. Jim McDonald. How has the transition been? Dr. Alexander Scott and the whole team, yourself included, worked to the bone, but clearly she didn't get along very well with the governor, certainly at the end. It seems like there's a healthier relationship now. Philosophy difference, approach difference, tell us.
You know, I actually got a warm handoff from the director, and I really can't speak to her relationship with the governor because she didn't really talk about it that much with me. You know, as far as I know, I'm having a fine time getting on with Governor McKee. It's been easy to get along with. I'm an agreeable guy. He seems like an agreeable guy, and we've had wonderful conversations. I've been here 10 years, so it's not like I don't know my way around the place here. You know, I know where everything is and who the people are who work here. So I think that's made the transition a lot easier for me. It was nice for him to come over, by the way. People loved it when he came over and shook hands with a lot of people. I think that type of thing really matters to people. They like to see people and say hello in their workspace.
You were asked during your first informal introduction as the interim director whether you wanted the job, and you kind of you said, I don't want to talk about it now. I do the math. You make $1.90 in your job. The constitutional provision for the director is $1.40. I wouldn't take a 35% salary hit for this deal. So, you know, yes or no, is that something that you're going to compete for, or just be a leading transition role here?
Yeah, you know, when I told Governor McKee I was here to help and help any way I could, and you know, I don't want to get ahead of him. He's the one who makes these decisions, and what I'm trying to do, Dan, is just be helpful to him, because quite frankly, we're in a very interesting time in the state. There's an awful lot going on in the health department. Last thing people are doing is worrying about what I'm doing for a living. But quite frankly, if I can just be helpful to the governor, helpful to the state, that's all I'm trying to do here.
All right. Listen, we'll keep the dialogue going, I hope, on the radio as well on a regular basis, because I do think this is going to be kind of day-to-day intensity between now and March 4th and probably beyond. But I appreciate your accessibility. And no matter what the consternation is, it ain't an easy job. We appreciate that you do it. Thanks very much.
Thank you, Dan. Have a great, keep up the good.
All right, we'll take a final break and come back for a final word when we return. Stay with us. I know we don't have much patience left, but it's going to require a lot of patience over the next few weeks while the school decisions are made on masking. And not just for the few weeks, for the rest of the spring. So deep breath. We'll talk with you each day about it, weekdays 3 to 6 on WPRI. Thanks for tuning in, and we'll talk to you next week. Good night.